Hello. Today I'm going to talk about the Section 37 hospital order. Section 37 comes under Part 3 of the Mental Health Act and is to do with criminal proceedings. If a person has been convicted of a crime that would be punishable by a prison sentence and they have a mental disorder, the court may choose to order a hospital admission for treatment for the patient instead of a prison sentence. 2 doctors need to complete the recommendations, and one of these must be a Section 12 approved doctor. They can both work from the same hospital. The 2 doctors must agree on the same diagnostic category, which would be either mental illness, mental impairment, severe mental impairment, or psychopathic disorder. A hospital to which the patient is to be detained must be written on the detention papers, and there must be a bed within this hospital within 28 days. If there's not a bed immediately following the court order, the patient is most likely to go back to the remand prison where they came from. Section 37 does not have a defined end date, unlike a prison sentence. Initially it's for 6 months. Then if the patient still fulfills the criteria for Section 37, the responsible clinician can renew it for a further 6 months and then annually thereafter. The patient can initially appeal to a higher court within a strict time period after they've been sentenced to the Section 37. So if they've been convicted in the magistrates' courts, they can appeal to the Crown Court. If they've been convicted in the Crown Court, they can appeal to the High Court. The patient can also appeal to the hospital managers within the first 6 months of a Section 37. Once this Section 37 has been renewed, the patient can appeal to a mental health review tribunal and the hospital managers within each period of the Section 37. At any time, the responsible clinician can take the patient off the Section 37. As regards leave, the responsible clinician can write up Section 17 leave as for any other patient. Within the first 3 months of a Section 37, the patient can be given medication without their consent. After that, the patient must either give their consent, or if they do not consent or do not have the capacity to consent to medication, then a second opinion appointed doctor will come and see them and assess their capacity and look at the treatment plan that the responsible clinician has written up to see whether they agree that the patient can be given this medication against their wishes or without their informed consent in their best interests. Once the patient has been taken off their Section 37, it is as if their conviction has been spent. Sometimes a patient may be so unwell in a magistrate's court that they're not able to take part in the proceedings, but if the court are satisfied that the crime to which they have been charged has been committed, then they can place the patient on a Section 37 without them being convicted of the crime. And in case of somebody not being able to follow proceedings in a Crown Court, then the issue of fitness to plead needs to be decided. Thank you for listening. I hope this has been interesting to you. I'm Dr Beth Colby. I'm a psychiatrist in London, and this is my YouTube channel, Talk Mental Health. Please like and subscribe. Thank you. Bye.